everyone. My name is Negi. Today I cannot have anyone else better than someone who is here with me, Vinu. First of all, how are you, Vinu?
I'm good. How are you, Negi?
I'm good as well, and I
Awesome.
hope you're super excited because I have so many questions for you, so many myths versus reality, rapid fire ready for you. Is pelvic physio.
Yeah.
You talk about it so openly, right? And we
Yes.
know it's such a taboo topic. A lot of
Yes.
people don't talk about
Yes.
it. We as women don't talk about it.
Yeah.
We've made it such a
Yeah.
taboo topic. How would you? Give me 3 reasons
Yeah.
that people should come in without any hesitation to see you
Yes.
for pelvic physio.
Yeah. So 3 reasons. I would say like every woman should get
Yes.
it no matter what, because
100%.
unless you assess it,
Yeah.
you cannot know how it's doing.
Can you give me the age? Like when you should
I
start
would
seeing
say
you?
from maybe 20 to
Okay.
80.
Yeah.
Yeah,
Okay,
so
fair
it's a
enough.
wide
Yeah.
range, right?
Yes.
But every woman should get it checked because we don't really know what would be
Yeah.
going on inside because
Yes.
there are muscles inside.
Okay.
And unless we check it, we would not know.
Okay. And give me 2 other reasons.
2 other reasons. Okay. Well, common symptoms. Maybe I should give you a
Yes,
symptom
100%.
so then maybe it'll help people
Yes.
relate. One, certainly pelvic pain.
Okay.
Okay, so any pain inside your pelvic floor, even back pain or hip pain. So any
Okay.
pain around that area,
So even hip pain.
even hip pain.
Okay.
Certainly, because
Interesting.
a lot of the hip muscles are attached inside your pelvic floor.
Okay.
So, imagine those muscles are being pulled from the inside.
Okay.
Wouldn't your hip hurt then?
That's why the hip exercises are so much in pelvic. Okay. Makes
Yes.
sense. Now it
Yeah.
makes sense. Okay.
Right. Okay.
And then the one more.
One more would be incontinence.
Explain that a little.
So incontinence means, like you want to go to the washroom all the time and you're not able to hold, so you end up leaking. It's a very common problem.
Yes.
But because it's very common, people think it's normal.
normal.
I say it's common but not normal.
No. Okay. Well, that's actually a big knowledge
Yes.
because you see it in a way where I think it's very common for people to think
Yeah.
it's okay to go to the washroom a couple of times,
Yeah.
especially being a woman.
Yes.
There's a lot going on
Yeah,
down there that
right.
you normalize a lot of things
Yes.
because you don't get to talk about it.
Yes.
Right? And when you talk to other people who don't have knowledge about it, and they're like,
Yes.
yeah, it's okay, it happens to us too. Right? So no,
Yes.
that's actually really good having
Yes.
that knowledge. We will obviously have a very brief talk on this pelvic floor. We'll have another episode coming
Okay.
out.
Yes.
But I really want to jump into TMJ as well with you a little bit of, because I want this episode to just get to a little bit do everything that you
Everything.
do.
Okay, got
Because
it.
you do TMJ, you do
Yes.
IMS, you do pelvic, postnatal,
Postnatal, yes.
and then obviously physiotherapy.
Yeah.
I would say, what's TMJ?
So TMJ is the pain in
Yes.
your jaw,
Yes.
in the joint,
Yeah.
which can lead to difficulty like chewing,
Okay.
opening your mouth wide open, even yawning, like
And it hurts.
it hurts.
Okay.
Sometimes to the point of speaking,
Oh,
even that can hurt,
wow.
leading to again headaches and sometimes dizziness.
Yes.
It's all related. So yeah, that's something we definitely can treat.
And then a lot of people might not know, but you do IMS for the jaw.
Yeah.
IMS is needles, dry
Yes.
needles.
IMS is
Yeah.
dry needling.
And then you do needles for the TMJ
Yeah,
as
I
well?
do
Okay.
the needles on the small muscles. There
Okay.
are a lot of little small muscles on the jaw.
Yeah.
I needle those muscles,
Yeah.
and that can make a difference. Yes.
Tell me something that people don't know about physiotherapy that you would want people to know.
Physiotherapy works.
I know, right? A lot of people have that stereotype that
I know.
it's just something athletes get it done. You know,
I know.
Okay, it does work. It's for
people keep
everyone.
telling me that, I don't think physio works.
Okay, and what's the main reason? What do you think people say that?
They just put me on machines. That's the commonest thing I hear.
No, 100%.
I mean, certain conditions, like when people are very sensitive and things like that, then sure, maybe we can use a machine and stuff like that. But otherwise, really, the physio's job is to like really find the problem. What is the problem? Sure, we can treat it to help the problem, but we want to also correct the problem
100%. Yeah.
and prevent the problem.
Yeah.
So there's a lot of things that goes, assessment. Treatment,
Yes.
prevention,
Yeah.
strengthening, so many little things.
Yeah, 100%.
And it works for so many different things, like orthopedics is something we are dealing with, but in physio there's also like neurology, cardiology, so many different scope of physiotherapy, it does work.
Awesome. Thank you so much, Meenu, once again for sitting with us having this conversation. I hope it helped a lot of people. And we will be back again here, and especially with you, we will have one more, a lot of a deep, brief conversation about pelvic floor and
Sure.
pre-postnatal.
Yeah.
Super excited for that. So we'll see you next time. Until then, stay tuned.
Thank you.
Thank you.